design of today's town hall is essentially to update you as to what we have been up to for the past several months. You have packets that give you some indication of what's been going on, and I would ask that you go through it. There's a lot of information, and there will be information that's shared with you as you leave in terms of some health kit packets that have, as I indicated, been prepared. But this is a good news moment for us, and we need to acknowledge it for what it is. And so I will give what is essentially an overview. Everybody say overview. Overview. And those who will follow me will drill down with some degree of specificity on the various aspects of our new plan and ideas. And so most of what we are going to be talking about deals with a vision, a purpose, an understanding of what can happen in the context of this community, these communities, to improve the quality of life. And there's a lot going on, and so I'm going to kind of push forward with a fair degree of speed, but I think you will understand how much is going on and how much your input will ultimately be valued. We talk about a new hospital, and these are some of the dimensions of it. An emergency room, an operating theater, ancillary services, anchor for community-based outpatient clinic services. We have financial models and assumptions based on inpatient delivery to Medi-Cal and medically indigent. Scheduled to open at this point in time, we project by the end of 2012. Everybody say 2012. Anybody who is afraid to set a date for the work that they're trying to do is not serious about getting that work done. We're setting a date and we're going to drive to it. That's the point to be made. Next slide, please. All right, now, this is catalytic. We're going to add new meaning to the notion of change. This didn't happen overnight. We are talking about being deliberate in our planned pursuit of this health-based community. And so when we think about change absent results is merely an abstraction. Dr. Rousseau, Reverend Rousseau, change absent results is an abstraction. It sounds good. It's a good conversation, but not much more than that, Brother Brown. So it seems to me that we need to talk about this in rather specific terms. Please proceed. At this point, what happens here in terms of improvement is not self-contained, Mr. Louis. It is essentially value added for the whole county. Bishop, for the whole county. And so it is not simply reducible to the Watts Willowbrook community. Obviously, that's important. That's why we're here. No second-class citizens. We believe that this is an opportunity to drive the quality of health care up in this environment, but when you do that, you benefit, once again, the whole county. It encourages community-wide participation via community advisory councils and other ways for communities to participate. And this is basically the notion of empowerment. My career in public service is basically committed to how residents, stakeholders, and the like have an opportunity to participate in the process. It is essentially the notion of self-determination that we are teaching at every juncture. And this experience, the highest priority in the 2nd Supervisorial District, is a concrete illustration of how that will happen. And so if you think, just for a moment, this conversation today is but one example of the ongoing dialogue that will take place between community stakeholders and those of us who are in leadership positions to help make this project happen with the appropriate level of involvement, and it will become more defined as we move along with your input. Your next slide, please. Well, now, so that you're clear about this, we've already begun to figure out what these things are going to cost, and resources have been earmarked to do so. So the first project is valued at approximately $4 million. The medical campus master plan yet to be determined. The South Health Clinic is 19 million, and you notice January 2010 when we began construction, the Community College Health Training Academy, we slate for January 10. You know that's right around the corner. And that's right. Have to hurry up and get started, because you know what? We're overdue. We're overdue. The new hospital, the emergency room, September 2010. That's why we need to push. Everybody say push. The reason we have to push is because, you know, you can't build a hospital in a month or two. You got all kinds of stuff that you have to do. You got to check off here and check off there. You got to get the design done. So what's the new policy direction? Well, we're going to emphasize local hiring. And if it doesn't have local hiring, it doesn't make sense to me. I know that it can be done. And you know what else doesn't count? Excuses. Local hiring is fundamental. We'll say more about that later on. We're going to build in this new policy direction on public-private partnership. If you want to get it done well, there are things that the public sector can learn from the private sector. It will drive up efficiency. It will drive up the quality of what needs to be done. But as a person who's invested his career to date largely in the public sector, I wanted to be appreciated that I do not believe in the inherent superiority of the private sector. There's a reason. There's a reason for the public sector to do what it does. And in many instances, it takes, well, you might say it this way, the private sector can help the public sector become more efficient in certain ways. But it ought to be appreciated that the public sector often has the capacity to keep the private sector honest. Health information technology, huge. Nobody's trying to build new medical centers that don't understand the implications of technology. And that's why I introduced a motion a couple of months ago to get the county moving along that path at MLK. That's where we're going to start. And before I could get the motion adopted, the point of view that was expressed by some was essentially this. Why are we just doing that at MLK? Why can't we do it all over the county? Did you ever think that the moment would come that the Board of Supervisors would, let's follow the lead that MLK is beginning to establish? That's what we want, ladies and gentlemen. And they are with the program. And so don't think any of this is going to happen without the full consent of the board. And I'm pleased to say that we are working very effectively toward that end to accomplish that. And so we want to acknowledge my colleagues who are on the board, who have already made it clear in any number of instances that this is a priority that has to be addressed.